When I select a patient for I.U.I, it is very important to see that the woman has patent tubes, that is, the fallopian tubes are open, the semen count is at least more than 5 million per ml, and the woman is capable of ovulating. So these are the three criteria which are really very important. So when a patient comes to me and they've undergone all the previous therapies like an HSG is an X-ray by which we check whether the tubes are open or not. And if that is normal, then we would subject the patient to I.U.I. I.U.I consists of two parts. One is ovulation induction, where I would give tablets and injections to this patient to produce eggs, which is usually started on day 2 of the cycle. The tablets are given for 5 days and the injections are then started on day 7 for 3 to 4 days. The growth of the egg is monitored by ultrasound or sonography. Once the egg reaches about 16 to 18 mm in size, the ovulation trigger is given. This is another injection which consists of an HCG or a GnRH agonist. Once this injection is taken, usually the egg ruptures 36 to 40 hours after this particular injection, and that is when we time the insemination. The insemination is done at the clinic. Usually the sample is collected by the husband in our semen collection room. This semen is then processed in the laboratory. In the laboratory, we feed the sperms and clean the sperms and harvest the best possible sperms with the best motility. And these are then gently deposited into the uterine cavity. This procedure takes like between 5 to 20 minutes. It's very, very simple. We don't use any antiseptics for cleaning, and the girl can go home the same day. The patient is then told to do a repeat sonography on the evening of the I.U.I or the next day to confirm if ovulation has occurred. If no ovulation has occurred, we do a double insemination and repeat the I.U.I the next day. If ovulation has occurred, we ask the husband and wife to have natural intercourse that evening. If I'm using a donor sample for insemination, then it is very important for the husband and wife to practice abstinence 4 days before the insemination and 4 days after the insemination, as this can really bring down the results. The success rate of I.U.I varies between 10 and 20% depending on the cause of infertility. On an average, the world results and our results also show that the success rate of an I.U.I is between 13 to 15% per attempt. I.U.I is something that's really important to understand, that you need at least 3 to 4 attempts before you give up. But in patients who are older than 35 years, I only do about 2 attempts. If I don't succeed, then I switch over to IVF or ICSI. And ideally, in patients over 40 years, it's better to do IVF. But of course, I am seeing a lot of patients with late marriages. They've just got married, they've been married for 6 months, and the girl is 40. Then obviously, I would try 1 or 2 cycles of I.U.I in this patient, and it would probably give us results.